So this is my face, and yeah, I read preoperative planning and care of a surgical patient. Operation is surgery, right? And then I read intraoperative care too, intraoperative procedures, something like that. So preoperatively, you start from just like management. You start from the history. You have to take your patient's history. You have to assess for the main cocoa of the history of the preoperative care and planning is to find out what medical conditions the patient is managing. After finding that out, you want to also try to diagnose a medical condition that will affect your surgery, but the patient does not know. So you want to do investigations to make it a newly made diagnosis, and you want to risk stratify your patient. You want to stratify the risk for the surgery. You want to know their functional status too. Like, is this person fit for surgery and anesthesia? And also you want to actually optimize them prior to the surgery, depending on how long you have until the surgery, depending if it's an emergency surgery, an urgent surgery, or an elective surgery. If it's an elective surgery, you have almost as long as you want to optimize. For an emergency surgery, you have to do the surgery while optimizing your patient, like the resuscitation, the optimization, and the surgery have to occur pari passu, something like that. And so you have to ask history. From your history, you elicit those things that their age. Now age is a risk factor for surgery. If they are elderly, you have to elicit those things. And also, moving on to systems, you have to assess their cardiovascular system. The cardiovascular system, someone that has a recent myocardial infarction, someone that has unstable angina, acute coronary syndrome, and we want to assess those things and optimize accordingly. You want to know their level of functionality, their MET, metabolic and something. I can't remember the full meaning. I'll check that up. So you want to measure all those things. You want to assess their renal system, their the risk for infection too. Does the patient have infection, and or you are anticipating infection after the surgery, depending on what type of surgery, the duration of the surgery, and also the kind of wound you'll be creating with the surgery. Is it a clean wound, a contaminated wound, a dirty wound, or a clean contaminated wound? You have to give antibiotics as appropriate. And also you have to check for the respiratory system. The respiratory system, actually, if a person has infection, you have to treat, or if the surgery is not emergent, you have to postpone till the infection is cleared off. The person has to cease smoking to make them more suitable for the surgery. The person has to if the person has asthma, if the person is they have to be on bronchodilator or something like that. And the renal system too, you have to avoid the use of radioactive, the contrast, that nephrotoxic substances for someone with high risk of high risk of renal injury following the surgery or even during the surgery. And also you have to put the the immune system into consideration. This person immunosuppressed, that would be under the risk for infection, for infectious complications of the surgery. And also you want to check their how do I put it? How you have to check their, yeah, if they have diabetes mellitus, you have to manage their glucose. You have to, you don't want to tilt towards hypoglycemia or hyperglycemia. You want to monitor if someone is how do I put it, is optimizing, is it optimizing, if someone is like maintaining their glucose level through oral, you can stop and not give anything. But if someone is using no, if someone is using diet to control their glucose levels, you can stop. You can operate without giving anything. But if the person is actually how do I put it, using oral drugs, you can stop the evening before the surgery. Or if the person is using a long acting, I think metoprolol or so, they have to stop like 2 to 3 days before the surgery. And if the person is using insulin, you have to use the Albati regimen or something like that. You have to have a dose before the surgery. You have to give insulin, weight it. You have to have a dose, and then you titrate. I think they call it SC. There's a scaling or something like that the person have, that you have to do for the patient, and that's basically it on intra. There's something that is flowing there. There's a butterfly. Pre-operative planning and care of a surgical patient.